everything derives from the menu. That's where everything starts, because without the menu and the recipes behind it, who knows what you're doing that day? It's picking products, it's picking recipes, it's knowing what kind of staffing does this building have? Can they do scratch? Do they have the labor to do that? Does the labor that they do have the skills to do that?
Tips from Trestle is brought to you by eMenu Choice Point of Sale, Wiseox AI, and Benny Keith Foodservice. Welcome to Tips from Trestle, the Senior Living Food and Hospitality Podcast. This podcast explores the senior living industry with a unique focus on food, hospitality, and the community experience. I'm your host, Aaron Fish. My goal for this podcast: educate, inform, and inspire leaders in senior living. How? By bringing the resident and customer experience to the front of mind in our industry. We should bring the passionate spirit of food and hospitality to everything that we do and everyone we serve each and every day. So what are we waiting for? Let's get to it. Today on Tips from Trestle, I'm joined by Joyce Lamilla. Joyce is a seasoned professional with over 30 years of experience as a registered dietitian. Currently serving as the Director of Healthcare and Nutrition Solutions at Benny Keith Foods in Fort Worth, Texas, Joyce has been with the company for over 12 years, showcasing her expertise in various roles. As a fellow of the Academy of Nutrition and Dietetics, Joyce continues to demonstrate her dedication to advancing the field of nutrition and healthcare solutions. In addition to all her professional duties, she also has 4 grandchildren under the age of 3 who keep her busy in her downtime. Joyce, thanks for joining me today on the podcast.
My pleasure.
So I'm excited to visit. One, we've known each other for a while. We've worked together in a bunch of different ways, but our conversation is going to be about your role as a dietitian at a food service distributor. Because I think a lot of people think about a dietitian and what they do in an operation, and you definitely have that experience, but you do a lot of other things too. So let's start first, I guess, to tell us how you got to the role you're in at Benny Keith. What was that journey like?
Well, I never would have thought that I would be working for a food distributor. I started working like many dietitians do as a clinical dietitian in a hospital. Then I worked in a long-term acute care hospital. Then I spent about a decade working as a consultant dietitian in nursing homes. And I did a variety of clinical operational duties and was perfectly happy where I was. And then I happened to be at an academy conference, like a conference that we're at today.
Yes, I should have mentioned that earlier. We are at the Assisted Living Association of Alabama conference. That's how we were able to sit down together.
So I was at a conference having dinner with a bunch of people, and the person who had my role that I had when I first got to Benny Keith happened to mention that she was retiring. And one of my coworkers who was with me at the table was like, "You should apply for that job." And I thought, why? I'm happy where I am. But then I thought about it, and the next day came back and asked, "Tell me more about your job." And she did. I applied, and the rest is history.
Yeah, it's always funny how people ask their backstory, how they got where they got. It always feels like anybody that works in healthcare, senior living, it was never the intended path. It was never what I thought I was going to be when I grew up, but we fall into it and we find, oh, this makes sense. This is what I want to do. So let's talk about, you have all that operational background as a dietitian. When you started working at Benny Keith, how is that the role that you have now and what you do different than if you were working in an operation? Because you still work with operators.
Yes.
But there's definitely a difference.
Yes, for sure. Definitely my background played into, I think I have a lot more empathy than most people would for what the dietary managers in a long-term care facility, a hospital, an assisted living, their day-to-day life is so difficult.
Yeah.
That having that background, everything that we do and everything that I have brought to my current role has been, how can I make their lives easier and So we have really tried in all of the things that we do to think about them. And so while I don't see individual patients anymore as part of my job, I do help our current customers with cost control, or I could do a sanitation audit that as a consultant dietitian, you could do those things, but we just do not do individual patient counseling or assessments.
Yeah. And when you get into thinking about the role and how it's different, do you ever miss the interaction with the residents, or do you find there's enough reward helping the operators make that connection?
I do miss the patients. I still think about some of my patients or residents that we have that would come every day over and just we'd sit and chat and talk. I do miss them. But there's such a broader audience that I can help now because I still think about those people that I helped. But now I'm not just helping these people in this one community. Benny Keith has a huge footprint, and
Yeah.
now I'm helping people in 21 states.
Yeah, I definitely relate to that, right? I started Trestle because I'd always worked for an operator management company, 25, 30, 40 communities. You're impacting a lot of lives, but then you can impact that many more when you are broadening that horizon. And so for me, it's kind of the same where I'm like, yeah, I do miss interacting with the residents on a regular basis, but I also know that because I'm helping out the people helping them out, that I'm having a bigger impact. So when you get into the nuts and bolts of what you and your team do, how do you, as a food service distributor, dietitian, support them? Because clearly you're not doing audits and assessments all the time, and you're not looking at operations, but maybe you are. Walk me through a little bit of how you guys operate and support your customers.
Our whole job is thinking about our customers. What can we do to make their lives easier? We have a variety of dietitians in different roles. We have 17 different dietitians that work for us in different roles. Menu specialists. We have healthcare specialists in each of our divisions. We have healthcare corporate account managers. We have business application support specialists. So there's many different roles that a dietitian can play. And I don't think a lot of people, especially if you're in school studying nutrition, think about what would I do if I worked for a food distributor. But if you are more operationally or technology minded, you might want to be one of the business application support specialists, helping our customers use the technology. If you're more spreadsheets, and maybe you would want to be a healthcare corporate account manager because you want to be able to dive into the cost cutting and GPO compliance and things. Or if you're more relational, maybe you would want to be business development. There are so many different things that you could do. And of course, our menu specialists, they're kind of I would say, the meat and bones of the whole operation, because everything derives from the menu. That's where everything starts, because without the menu and the recipes behind it, who knows what you're doing that day. And helping our customers nowadays with cost control, the menu plays into that. It's picking products, it's picking recipes, it's knowing what kind of staffing does this building have? Can they do scratch? Do they have the labor to do that? Does the labor that they do have the skills to do that?
Yeah.
So knowing about your customers and knowing what they can handle and how much they can handle is so important.
Yeah. As you were going through all the check boxes of menus and technology and business development, I was sitting here thinking, if you're a solo dietitian working for an operator, you got to figure out how to do all of that, right? And so I'm just sitting here thinking, like, if you really did want to be a specialist and you really did have that passion, like, you could find it that way, probably a lot faster and a lot better. And I'd say maybe even more happily, without having to go through the trials and tribulations of doing the operation stuff. And so you talked a little bit about menu development, and I know I'm very familiar with how you guys approach menu creation, having been a previous customer. And when you think about how you guys approach that, I feel like you guys are a little bit unique in that, yes, you have software. Yes, you have the customer can build their own menus if they want. They can design their own recipes. But you guys do take a little bit more of a hands-on supportive role. And so I'd love for you to talk a little bit about how that has evolved at Benny Keith, because like you said, it's a super important piece.
Technology continues to drive changes in senior care, and that includes food service. eMenu Choice is an award-winning point-of-service application for managing the dining function in senior living communities. This mobile, touchscreen-enabled software enhances the dining experience for residents while streamlining processes for staff. The flexibility and functionality of eMenu Choice makes it an effective solution for any type of senior living environment, from independent and assisted living to skilled nursing facilities. It works for production kitchens or restaurant-style service with options for per meal or a la carte pricing, and accommodates a variety of payments, including bill to account, meal credits, and credit cards. Created by a senior care provider with more than a century of experience serving older adults, eMenu Choice eliminates communication barriers between staff and residents while enabling person-centered choices and greater resident satisfaction. eMenu Choice, transforming dining for senior living.
Yes, I would say when I first started, we're still doing the same process of menu development. What has changed is now order guides. I think people are using order guides that are closed and this is what you're allowed to order. It's not giving, especially places that have multiple locations and they have a big corporate structure. They are really in control of the order guides. We are working with the GPO with knowing what has deviations. So if there are 20 different chicken breasts that they could order, no, we're going to narrow that down so that they order the best one for them.
Yeah. And I think one of the things that, in working with, like, say, a GPO, they can help you with maybe the numbers piece of that. I've worked with GPO partners who will, here's your spreadsheet, here's your cost analysis, here's the substitutions and recommendations. But you guys are able to take it a step further and saying, okay, well, yes, here's the chicken fried steak, or here's the chicken breast you should use. How many different ways are you preparing that chicken breast? Like, what kind of recipes, what kind of regionality? And so you guys add that extra layer in doing that, which I think absolutely is important when operators look at that process.
Yeah. And we customize almost every menu that goes out the door, because when I was a consultant dietitian, I had 3 nursing homes in the same town. They had totally different clientele. So they would have wanted 3 different menus to suit their clients or their residents. And so we don't assume that anybody in Texas and Florida are going to want the same menu.
Yeah.
So we have a base menu or multiple base menus that we can start with.
Yes.
But then we let our customers customize it to their communities. To me, the worst thing that we can do is have a menu that is just, this is the menu for everyone, and then wind up throwing food out. Because food waste, that's just money that's going in the garbage can.
Yeah. I remember working with the team that you have and being like, hey, I need a bronze menu. I need a silver level menu. I need to go. I mean, when you're managing 50 communities in 7, 8 different states, you got to think like what you're just talking about. And it was super easy to be able to do that because it was, hey, here's that base starting menu. Oh, well, for this one, maybe you should start with this menu. So you were able to give me and my team a runway to start. And then we were able to give you guys what we needed. And the outcome was always really great.
I'm very glad to hear that. But yes, our dietitians work so hard at customizing the menus for that particular customer, and back to recipes, back to the skill of the staff member. So really working with our customers, not assuming anything.
Yeah, super important. I want to ask a little bit about the technology, because I feel like in senior living, we maybe have crossed the bridge of being afraid of technology. A lot of people are using point of sale. I get a lot of questions about, well, what systems would you recommend? Like, I was talking to a prospect just the other day, and they're like, we're going to be changing that. And so we're going to want to talk to you about that. Okay, great. Sure. How is the way you guys use and support operators with technology changed over the last few years?
Good question. Yes, actually, we are now moving from one menu platform to another because of the increased technology needs of our customers. So we wanted to keep up with the times and ahead of the times. So now we're able to offer tableside dining and things that in the past we just couldn't because our technology wasn't there, and now we can.
That's really exciting because, I'm a big proponent of like, this needs to be a dining experience. It's not just like really good food 3 times a day, but like people are looking for a change, looking for something different, and having those options is really great. So,
Well, if you think about, I always go back to my dad because he's in his 80s and he could be a resident at any of these
yeah,
places. He happens to live independently, but he's traveled the world. So our now seniors that are in senior living, they are not going to be the people that are happy that if everybody is getting meat and potatoes tonight, that they're
yeah,
going to be happy. No, tonight I want fish. So giving them the opportunity to make a choice of what they're eating that meal is going to be so important.
yeah. I just finished with a client in South Florida, and they wanted a vegetarian menu. So they wanted to be able to add items. They didn't want a full vegetarian menu, but that's not something even 5 years ago that somebody would have asked me for, or a community saying, hey, we need that. So it's so important that you guys are making those changes. I love that. When you're talking to an operator, maybe a new client, new customer, and they think, oh, well, it's great that you've got this, I'll use air quotes, team, because in their head, they're thinking, well, this is just that many more people who are going to bombard me with emails, trying to sell me more stuff. What would you say to those people about what you and your team do in regards to not really being the sales team?
We are definitely not a sales team. If anything, I would think a salesperson would not want us because our whole goal is to keep our clients in budget. Because if our customers are not in budget, they're going to get rid of us. So our goal is to help them, knowing what their budgetary concerns are, to stick within their budget. We're always looking at, oh, there's this new product. You might find this helpful because it's lower in cost.
Yeah, that does seem kind of like the antithesis of selling, but it makes sense.
But that's the way you keep a customer for 10, 20, 30 years is
Yeah.
by helping them find solutions to manage their business within the budget that they have. When the bird flu hit, we were like, you know what? We need to come up with some alternative breakfasts for our customers that they're going to go way over budget if they're serving eggs every morning.
Yeah.
So just proactively trying to come up with ideas and solutions to help our customers stay in budget is our goal.
Yeah.
And
We're talking about, you're more on the retention side of, all right, this, you've got the customer, now they're happy. Your job is, I want to keep them with me because
exactly.
we're now going to be a partner of theirs. We're not just a service or general distributor for them. I remember during COVID, the company I was with was a Benny Key customer. It was every day, every week, like, what's going to be available? Like, what can we have? I was able to have conversations almost daily if needed with someone at the Benny Keith team to help me with what you just described. Like, what's the product? What's available? What can I get shipped? Well, how can I make changes to my menu? Which I think was a huge help, being able to reach out and say, hey, Joyce, I need your help with these products. Like, this isn't available. I had someone on the other side of the distribution team say, these aren't coming in. So how can I change my menu? And being able to have that kind of personal touch and being able to work with that, even though you have a big team, I think is really great.
I agree, because so many of our competitors have gone to a 1-800 number. Benny Keith still has salespeople, which I think is great. And again, our salespeople that sell healthcare, they know also that they cannot just sell them everything,
Right?
Because they will not keep that customer. So their job, we have trained them, is to keep the customer in budget.
Yeah, I was going to ask, how do you interact with those salespeople to be able to make sure that all of that happens? I'd love for you to maybe expand on that a little bit more.
And I guess I never even really talked about Benny Keith as a company.
True, I haven't asked you that.
Our listeners who haven't heard of us, because we are not in every state. So
Right.
not everyone might not have heard of Benny Keith, it's been around since 1906. We are a broadline food service distributor, but we operate in 21 states out of 10 distribution centers, southwest to southeast, basically. Within that, we do have healthcare specialists, each division, and they, along with our team, are educating our sales team on how do you take care of a healthcare customer. And they are in there working with our healthcare customers on cost control and following GPO compliance to try and maximize their savings.
It's such an important role because I know, having had a little bit of experience selling in the healthcare space, that support is important. If you're trying to I got to help my customer be successful, being able to pick up the phone and say, "Hey, Joyce, can you help me with this?" That's a huge benefit.
Yeah. And we have GPO account managers that are combing through there saying, you know what? You're buying this, but if you bought this product instead, you could be saving this much money. And it's up to the customer to decide if their residents love Blue Bunny ice cream and saying, "No, I don't want to change."
Right.
Okay, that's fine. But if it's something that the resident's not going to notice the difference, or if the quality is the same, then why wouldn't I buy that product and save some money?
Yeah. I always think of the color-coded sugar packets on the table, right? I'm always like, well, if I can't tell who the distributor is by looking at those packets, then obviously there's something wrong, because that's an area of opportunity, because it's the same thing. So this has been a great starting of the conversation. I know that we're going to talk with some of your customers and probably other people on your team throughout the year with our partnership, but I would love for you to tell our listeners as we wrap up here, how can they connect with you? How can they learn more about Benny Keith and start that dialogue about how you can support them with their dietitian needs?
You can go to our website, www.bennykeith.com. My email is jdlamilla@bennykeith.com. And I'm sure if anybody reaches out to you, you can direct them.
Definitely go and find you on LinkedIn too. I think that's where everybody says, go to LinkedIn. You got to find me there. Well, Joyce, thank you so much for taking time away from the conference. I know that there are sessions going on and we want to get back in there, but I appreciate you breaking away for a little bit and sitting down with me today on Tips from Trestle. So there it is, everybody. Another one in the books. Thanks again for tuning in. Please follow, like, and subscribe on YouTube, Spotify, Apple, or wherever you get your podcasts. And be sure to follow us on social media at Tips from Trestle. You can also learn more about the work I do by following me on LinkedIn, Twitter, Instagram, and even TikTok. And be sure to check out Trestle Hospitality Concepts at www.trestlehospitalityconcepts.com. I'm your host, Aaron Fish, and this has been another episode of Tips from Trestle.